All right, it is 6 p.m. on the dot, so we'll go ahead and get started. Good afternoon, everyone. My name is Rita Gay. I have the pleasure of serving as the Southeast Chapter of SCCM President for this term, and I would like to welcome you all to our quarterly educational meeting. We always start our meetings with our mission and vision, followed by some announcements. So I'd like to remind everyone of our chapter mission, which is to secure the highest quality of care for all critically ill and injured patients in the Southeast region by providing educational and research opportunities, as well as promoting multi-professional collaboration. And our vision is that all critically ill and injured persons in the Southeast region will receive care from a present, integrated team of dedicated and trained intensivists and critical care specialists, as well as inspire new leaders and providers of critical care in the region. With that said, we have more information on the chapter that is available on our website. Our chapter covers 7 states in the Southeast area, and it is a multi-professional organization representing physicians, nurses, pharmacists, respiratory therapists, OT and our PT colleagues, physician assistants, and other healthcare professionals. And our goal is to encourage SCCM membership as well as chapter membership, and to build networking opportunities as well as education opportunities within our region. Membership benefits are available on our website, which is sccmse.org. So we invite you to visit our website and feel free to reach out with any questions that you may have. I would also like to remind our audience that our summer chapter newsletter has been published. Again, it is available on our website, sccmse.org. This newsletter has information, has recaps from our quarterly educational meetings. It also has all the links to all the talks that you would be able to find on our YouTube channel. Additionally, it has information and updates from all our events of this year. In terms of upcoming events, today we have the pleasure of hosting Dr. Heatherlee Bailey, who I have the pleasure of introducing in a couple minutes, who's going to be talking to us on the challenges and management of the critically ill patient that is boarding in the emergency room. To claim CE for this talk, we are offering physician, nursing, pharmacist, and dietitian CE for all our chapter members. So please make sure to complete the following survey using this QR code or the link available.
He's about to.
Within there. Can I please ask whoever joined to please mute, for everyone to mute? Thank you.
Hope so. Well,
okay. So our CE credit is available. The survey will be open for 2 weeks. The deadline to submit for the survey is going to be October 25th. And please, again, use the QR code or the following link, which is kind of small to see, but the QR code should take you straight to the survey to complete. During the month of October, actually at the end of this week on Saturday, we are proud to be bringing back in-person Spike Up Sepsis. This is an initiative that our chapter has carried on for years, especially during the pre-COVID years, where we would get together for an amateur volleyball tournament and all get together to raise money for the important cause of sepsis. All the money goes to Sepsis Alliance. We encourage you to cheer on your team. If you check out spikeoutsepsis.fundraise.org, you'll find more information on the teams that are signed up. This year, we are at a new location in Chattanooga, Tennessee, and we're really excited to work with our chairs and active members in the Chattanooga area. If you're unable to attend but are still interested in this event, we encourage you to visit the website again or use this QR code to get you directly to the website to contribute to this great cause. Again, all the proceeds will go to Sepsis Alliance on behalf of the chapter and all the members in the chapter. During the month of November, we have a couple of events coming up. One of them is our bite-sized lecture, which is typically a multi-professional panel that focuses on one topic. The topic for November is going to be fluid stewardship in the ICU. And we have a physician as well as a pharmacist speaker that will be leading us in this talk. We highly encourage you to log in. This is meant to be a lunch talk, so it will be from 12:30 to 1:30 Eastern Standard Time on Wednesday, November 9th. And we typically have time at the end to ask questions and get the panelists' opinions. If you have any ideas for future topics that you'd like to suggest for the bite-sized lecture, please contact our bite-sized lecture coordinator, Nick Barker, and here's his email. Additionally, the chapter will be holding its annual business meeting in November. The date will follow. This will be a virtual meeting over the course of an hour where we get to update all our members on all the happenings of the chapter, the events of this year, as well as our plans for next year. And we absolutely look forward to your input and your ideas. So please be on the lookout for an email from our constant contact account to give you more information on how to log in. Additionally, we're always looking for our membership input regarding topics and speakers that they would like to hear from. So if you have any ideas, feel free to contact our education and our programming committee chair, Doug Smith, or you may also contact the chapter directly and we'll make sure to pass on that information. And with that, I would like to encourage, again, everyone to check out our YouTube channel. If you go in and look for the Southeast Chapter Society of Critical Care Medicine channel, you'll be able to see our previous talks. And we also encourage you to follow us on our Twitter account, as well as our Facebook and Instagram account for updates. And with that, I would like to thank everyone who's joining us today, and I would also like to introduce our prestigious speaker, Dr. Heatherlee Bailey. Dr. Bailey is an emergency medicine intensivist. She attended Alfred University in Alfred, New York, and completed medical school at the Rutgers University of Medicine and Dentistry in Newark, New Jersey. Dr. Bailey completed her residency in emergency medicine at the Medical College of Pennsylvania in Philadelphia and then joined the faculty. After a faculty fellowship in critical care, she served as her department's director of critical care education and their associate residency program director. Over a decade ago, Dr. Bailey's career brought her to Duke University and the Durham VA Medical Center. She is currently faculty in the Department of Emergency Medicine at the Durham VA Medical Center in North Carolina. Her career has been rooted in education, trainee development, and mentorship. Her dedication and expertise has been nationally recognized. She was awarded the American Medical Association's Women's Mentoring Award in 2008. Given her prominence in the field, Dr. Bailey serves as an oral board examiner for the American Board of Emergency Medicine. Her career interests in the management of injury and critical illness span the globe. She was a key developer of the comprehensive Trauma Life course for India as part of her work for the International Trauma Anesthesia and Critical Care Society. Dr. Bailey has been very actively involved in the Society of Critical Care Medicine for more than 20 years, serving in a wide variety of roles. In 2009, Dr. Bailey's path of volunteerism, mentorship, and leadership led her to be the first emergency medicine trained president of FCCM. And with that, I would like to hand it over to our former president. All right, Dr. Bailey, you should be able to use your slides now. I think you may be muted.
There we go. Can everyone hear me now?
Yes, very clearly.
Okay.
Thank you.
And you can see the slides.
We see your browser, not the slides.
Dear, let's try this again. How about now?
Yep, we can see them now.
Excellent. Okay. Sorry for the technical glitches. I think you'd put the master mute on when you were getting the feedback.